All about the back. Quick question number 1. Wanted to know, are you just supposed to suck in your stomach while you do the ab brace? So ideally you want to draw your belly button in, but also think about that pelvic tilt that we went over. So you never want your back to be arched because that puts a lot of pressure on your low back. So you want to think about really pressing down to maintain that neutral alignment in your low back, so it's not just about like sucking your belly button in, but more engaging those core muscles. Awesome, thanks guys, back to you. Thank you man. Quick question number 2. We had a question about dead bugs. Someone wanted to know, what about doing them with your legs going straight out? One, you can definitely do that. That's going to be more challenging than the variation that we showed you. Again, when you're doing that, I would really focus on that pelvic tilt that we talked about at the beginning. Make sure your back stays flat against whatever surface you're on the entire time. Awesome, thanks guys. Thank you. Quick question number 3. Hey guys, sorry to interrupt, I have another question from the field. This is more applying to some of the ones we showed on the hands and knees. Someone asked, what if someone has issues to support their body with their arms? Are there modifications that you would recommend? Yes, so with some of the more stretches, there's another way where you could do that. If you have wrist problems, you can also try making a fist. There's also versions where you can do it on your knees for those rotational movements. So we can do like a half kneeling. Oh yeah, you can show this one. Yeah, that takes a lot of the pressure off your wrists. Yep. Another version you can do is like even sitting back on your heels like that. You can do your cat cows, right? It's less pressure on your upper body. Yeah, that looks good. Great, awesome. And another version he can do also is if you're like half kneeling, and we can do some twisting motions that way. So exactly, awesome, thanks guys, that's really helpful. Quick question number 4. Question: how long can general back pain, for example a pulled muscle, last? Is there a general rule of thumb for how long until someone can get back into a workout routine? Sometimes it can take around 6 weeks, right? But we want to make sure we're still maintaining use of our muscles and activation of them. That way when everything's all healed up, it's a way more seamless transition back in. So hence where some of these kind of more like foundational exercises we're doing here, more general mobility strengthening stretching ones, you can start to slowly integrate these to help you get back to where you want to be. Another thing to point out too is, some movement is better than no movement at all. We want to get you up and moving, but we also want to let pain be your guide, right? So if anything really aggravates your back, start with first line of exercises before you get back into a full workout routine. Quick question number 5. Into the QA portion, one person wanted to know, if you have bad knees, how could you modify a squat? So I would say a great way to manage that is to really think about trying to take some pressure off the front of your knees. So you never want to let your knees go too far past your toes. So that's why we really use that cue to sit back. Imagine you're sitting back into a chair. Another way to go about it is to not squat so deep. You want to go within a range that's comfortable, so right before that knee pain starts to kick in. Awesome, thank you guys. Another person wanted to know, is walking good or bad for lower back pain? They heard that you shouldn't use a treadmill. So as physical therapists, we're here to promote movement, right? Movement is good for you. It depends on what your condition is in terms of how much walking, but walking is definitely something that I would recommend, and that's where again I would consult with a doctor or a PT in terms of how much to dose, that amount and frequency of walking. Awesome. Yeah, I think a good rule of thumb is a lot of these are dependent on your symptoms and how intense things are, and a gradual increase is usually a really good way to go. Quick question number 6. A similar question was, is the elliptical okay for low back pain? I'll toss that to you guys. Yeah, it's a similar principle to you want to promote movement. Generally an elliptical is a little better than walking. It takes out a lot of that impact that might occur when you're walking on a harder surface. But yes, definitely letting your symptoms be a guide, and we want to promote as much movement as we can. So elliptical is usually safe for someone with back pain. Really good, really helpful guys. Quick question number 7. Someone wanted to know, how long should you do the exercises to help with back pain? All of the exercises in total, or I think it was more of a duration, frequency, how many times a week, how often, how long, and how many weeks would you recommend people do this to help? Okay, I would definitely say starting anywhere from 2 to 4 times a week. What I typically do with my patients is any strengthening exercises, I have them Do 2 to 4 times a week and then they come into the clinic 1 or 2 times a week or via telehealth 1 or 2 times a week, and then all of the stretching and mobility things you can do daily. Yeah, really good. And you know, everyone's a little bit different, so I think a good general rule of thumb is listening to your body and making sure when you do the routine that it feels good and it doesn't hurt. Quick question number 8. One person wants to know heat or cold for back pain relief. What do you guys think? So I would say it depends on what your symptoms are, right? So if you're having a little more of an acute flare up, ice is good to get things to calm down, and for pain management it's also good for pain management, but I would use heat more so if you're feeling tightness and you want to keep your muscles and the soft tissues in your back looser, loosey goosey. Very goody. Quick question number 9. Someone wanted to know if any of these are better to do as warm-up activities before a sport or an activity. Are there a few that you recommend is doing before playing a sport activity? Yeah, I would say it's a great way to get your muscles engaged before a sport. You want to make sure that you know your body is a little bit more warm before you stretch. It kind of just helps loosen everything up, and I think you'll start to feel a little better with some of the stretches and mobility exercises if your body is a little bit more warm, and then starting off with a lot of like the strengthening exercises such as the bridges or the dead bugs, even squats. It's definitely a great way to prepare your body for some higher level activity. Awesome. I would say also that some of the first couple ones also, like the bracing and the pelvic tilt. I was actually just telling a patient this morning. They have trouble engaging their ab muscles, and then it's putting more demand on their back, so doing things like that just to build that neuromuscular activation, if you want the fancy word, or mind muscle connection as I call it, that's a good way to just get things rolling before you go into your workout. Awesome, thanks guys. Quick question number 10. Someone else wanted to know if you have any suggestions for a tight quadratus lumborum. Alright, any of these exercises what you would recommend, or any others? Yeah, I think a great one was the child's pose that we went over, where you're reaching forward, and then you can also, depending on what side it is, start to work your way towards one side you want to stretch away from the affected side. I think that's a good way to stretch out that QL muscle. Yeah, you can also do another one which I can show right now if you're standing up, so whichever side is tighter is you're gonna take that leg. So let's say this is my right side is tight. I'll take my right foot and put my toes down behind my left foot. I'll take my right hand, reach up overhead, and then I'll put my left hand put on my hip, and then I'm reaching to the side, and then I'm using this hand to press my hips to the side, and that should just help gap and stretch, just like that child's pose modification that Mayor Review was talking about. Really helpful. Quick question number 11. Another question coming in, can you use a foam roller on the lower back? They've heard not to. What do you guys think? So me personally, I typically like to use more of like a lacrosse ball or something like that to get more localized one side at a time. In terms of addressing like soft tissue restrictions or muscle tightness, I think a lot of times with a foam roller it's easy to overextend your back and just irritate either soft tissues or the joints. Want my patients use the foam roller directly on their lower back, but it's a great way to kind of work out some of those tight muscles like along the back of the hips. Definitely very good. Another question that came up was, are these helpful for mid-back pain as well? Are there any specific of these exercises that you showed that you would recommend more for mid-back pain? I would say more for mid-back, a lot of more of the mobility exercises, so those cat cows or cat camels, even those open thread the needles where Scott was on his hands and knees and he opened up towards ceiling. It's a great way to get some motion and mobility in that mid-back. Quick question number 12. Yeah, absolutely agree. One more question here. Do you have any recommendations for helping to avoid back pain while doing step ups or step downs? Yes, so I would say you think that pelvic that we talked about is going to be really important for that. When you're stepping up and bringing your leg up, that is, one hip is going to go more into that tilt, right? So I would start by working on the pelvic tilt laying down, and when you feel ready and comfortable doing it, try it sitting down, then standing up, and then try doing that pelvic tilt while you step up and step down. And I think you kind of hinted at this, like a good way to start to get that control and that pelvic tilt is to do even some like seated marches. Quick question number 13. Another person wants to know, do you recommend anything in particular for people with low back pain who sit or stand at the computer a lot? I like to tell my patients, your body wants to move, right? It's good for you. Your muscles kind of created sometimes, so I tell them, set a reminder in your phone that goes off hourly, and that way it just says stand up or walk around, just to loosen things up. Make sure you're not in one position for hours and hours and hours on end. That's my tip. Yeah, that's a great point, especially now because so many people are working from home, they're not moving as much, so definitely setting like a little reminder for yourself, so just get up and move, take a lap around the house and then come back and get back to work. Yeah, it's important to just keep moving as much as you can. Quick question number 14. Yeah, this is a great question here. Any recommendations for nurses who experience low back pain regularly? I'm constantly leaning forward and repositioning patients who are often very heavy. Any suggestions for that? Definitely. I think that's where kind of like lifting mechanics that we talk with our patients about comes into play. I think that doing more of that hip hinging exercise is going to be a crucial one to just put more demand on your glutes and the legs with less cell on your back, especially you can't avoid that lifting at work, you have to do it, so you want to make sure you're doing it the safest, most comfortable way. Yeah, and since it does sound like you have to lift heavy, people doing some general strength training can be helpful as well, and under the guidance of a physical therapist or personal trainer. Somebody that can really make sure you're doing it safely and effectively. Quick question number 15. Alright, someone else wants to know, while cleaning their home, the lower back, it's very tight. Any suggestions for those motions? They were back support last time and it helped. Is a stabilization built a good idea? What do you guys think? Yeah, I would say if you feel it does help, nothing. I don't necessarily have anything against wearing a back brace or like a little bit of extra support. Ideally, you don't want to have to rely on the brace, so definitely kind of like keeping up with some strengthening like we discussed earlier, keeping in mind those hip hinge motions to avoid too much stress on that low back, I think will come and be very important to like help with the longevity of that back pain. I would just add also that that's perfect. Doing that of brace is targeting the muscle that is basically what the belt is mimicking, right? So you have to clean your house on a daily basis, you'll probably have to wear it for a while still, but if you're doing that bracing activity exactly, you should slowly be able to wean off of it. Quick question number 16. Thanks guys. Someone else wanted to know a recumbent bike versus an upright bike. If you have low back pain, do you guys have a preference or would you recommend one over the other? For me personally, I like to give a more acute patients a recumbent bike. It just gives them that back support that they might need. When you're progressing further along and returning back and your symptoms are minimal to not happening really, then that's when I started to transition people more to an upright bike. Yeah, and for me, I agree. Using the upright bike, you're going to use your core musculature a little bit more. So once you can tolerate it, I prefer to do that, so you get a little bit more back and core strengthening there. Somebody else wanted to know if they get back pain when they do crunches or sit ups, even when they try to kind of brace. Quick question number 17. Is there any other suggestions you would give them to help reduce pain while they're doing abdominal exercises? Yeah, I would say if that's too much of it sounds like it might be too intense of an exercise, so you might have to start off with some of those more foundational motions, so that brace and those pelvic tilts, before kind of progressing your way into a crunch. Like a crunch typically works more of your superficial abdominal muscles versus like those deep core muscles. Yeah, that's that's something that I've found is really helpful for having a therapist to teach you how to really engage those muscles correctly, because it's hard when there's multiple layers and sometimes you're not getting the right muscles to fire. Quick question number 18. Exactly. Somebody else wants to know if you have any suggestions on sleeping positions for people with low back pain. That's they have a little bit more of a specific issue, but I think for more general population, is there anything that you would recommend? It's hard to say when it's because there's so many potential reasons you're having back pain. So I would typically just suggest whatever is comfortable. Maybe that is laying on your back, maybe it is laying on your stomach, maybe you need to be on your stomach but put something under your hips, maybe you need to be on your side. It really depends on that one. I want to try to avoid putting too much pressure on your lower back. You can always try laying on your back with maybe your knees bent or like a pillow underneath your back. If you're more of a side sleeper, you can even put a pillow between your legs, and it kind of helps keep your hips and back a little bit more in a neutral alignment. Yeah, in our experience, I think everyone's a little bit different, so I would play around and see what's comfortable, but I do agree that a pillow between the knees on your side is often a good way to just feel supported and aligned. Quick question number 19. And I think I can answer this. It's pretty variable. Some people feel a lot of improvement after injections to the back corticosteroid or other. Some people don't really see much of a change. I think there's trial and error with these, and some people really feel a benefit and some people don't always get better. Some people can get pain after, although I think it's pretty rare. Quick question number 20. Somebody wants to know any suggestions for improving their posture, which I know is a general question, but for the general public, what would you say? Yeah, I can take it. So yeah, I would say just in general, keeping a better, I guess more upright posture is what we promote. So thinking about like really trying to keep your body upright, yeah, go forward. So thinking about kind of like rolling your shoulders back, that's not too far forward, and it brings you out of like that forward and hunched motion. Exactly. So this is kind of what most people end up doing typically throughout their day. So trying to keep your chest upright, yet even if you're like sitting at work throughout the day, you want to make sure you have like a good like chair with some back support. So whether you have like a pillow or like a towel roll, this happens to be like a pretty ergonomic chair, I would say kind of follows the natural curve of his spine, is a great way to kind of go about that. Thank you guys. I think something I'd add is, with everyone switching to working from home with this pandemic, a lot of us have had to find new ways to work. So keep in mind general ergonomics are trying to keep your monitor about the level of your eyes, trying to keep your elbows bent about 90 degrees at a comfortable level. Should you feel that you could benefit from individualized guidance and treatment, please don't hesitate to reach out to me. Power. Peace.